Hello everyone, this is Dr. Clark from the Center for Hormone Health and Wellness, and today I want to talk a little bit about how estrogen levels change as we age. Now this video is going to be more directed at women, but we will have this discussion again about how estrogen levels change with men. We don't generally think about estrogen in men. Today we're focusing on women. Okay, so the whole point of hormone replacement, especially with estrogen replacement, is to try to fix some of the symptoms that go along as estrogen levels then go way down. Basically, the definition of menopause is that the ovaries quit working. And the ovaries quit working, then estrogen levels drop way down, very, very low, typically not zero, because the adrenal glands can make a little bit of estrogen. So we think about when a woman is younger, she's having normal cycles. Typically, the estrogen levels during that normal cycle will also be fluctuating. That's what causes a woman to have a cycle. It's those changes. And they happen pretty regularly, about a month. Okay? And so subsequently then women will often realize that oh yes, certain things changing, it's time for a cycle. So what happens then as you approach menopause? Again, menopause just means the ovaries aren't working the way they should. They stop secreting the estrogen and the hormones that they should be during a normal cycle. So this can happen anytime from about the early 40s to late 50s. The average age of menopause is about 51. So at that time, with true menopause, the numbers go way down, not to zero, but very low. Prior to then, when you're having cycles, there may be estrogen levels that are 400 or 500 on certain days of the month, and then down into the teens on other days of the month. Again, that's normal. So one thing I would like to state with that is there isn't a right and a wrong number of estrogen. People often think, what's the right level? There isn't a right and a wrong level. But as you age and you approach menopause, you'll often get some perimenopausal symptoms. And that is due to there may be bigger surges and lower lows with those estrogen cycles. So the cycles are no longer, quote, normal, which may bring about some symptoms, often some similar to low estrogen. Night sweats, hot flashes. Those are the most common ones. So as you approach menopause, then as these cycles so that they get less and less normal, and subsequently the estrogen levels go lower and lower, night sweats, hot flashes become more prevalent. For some women, they may be debilitating. For other women, it's like, oh, it's a little bit of a nuisance. And just as with some women too, the menopause changes may be fairly, it won't actually throw your life completely out of whack. For other women, it tends to be very debilitating and may last indefinitely. The symptoms may continue on, not just for a short period around menopause, but for an extended period of time, years and years. These are the people that truly can benefit the most from estrogen replacement therapy, in that we can fix those debilitating symptoms that occur around the age of menopause when estrogen levels go really, really low. All right, so next time we'll probably talk a little bit about testosterone levels, and we will do a video on estrogen levels in men as well. So look forward to those in the near future. Have a great day. Take care.